Across the country today, there were 31 locally transmitted cases, the majority, 21, already in isolation. Only one person is in ICU, but lockdown continues for 12 million Australians. In New South Wales, there were 22 cases from more than 68,000 tests. Half of those positive cases were already safely isolating. There were 3 linked local cases in Queensland. They were all isolating. There were no cases in the Northern Territory, but a lockdown's been extended to Alice Springs because health authorities believe a man spent time in the airport while infectious. In WA, there was 1 locally transmitted case. They were isolating during their infectious period. 5 family members who tested positive in South Australia were also in isolation, and the state has avoided a lockdown for now. Victoria recorded a single case in isolation. There were no cases in Tasmania.
We're able to vaccinate our population safely, the better it is for us in terms of health safety, but also in terms of the economy and jobs and international trade.
The ATAGI advice talks about a preference for AstraZeneca to be available and made available to those as preferred for those over 60. But the advice does not preclude persons under 60 from getting the AstraZeneca vaccine.
I don't want an 18-year-old in Queensland dying from a clotting illness who, if they got COVID, probably wouldn't die.
I've been covering this pandemic since the get-go, and I don't think I've seen as much confusion as there is now. Astra was the backbone of our vaccine rollout until in March it became clear the vaccine caused a rare clotting problem, and that affected the advice.
At the current time, the use of the Pfizer vaccine is preferred over the AstraZeneca vaccine in adults aged less than 50 years who have not already received a first dose.
Things changed again in early June with the death of a 52-year-old Sydney woman from the clotting syndrome. It had a big impact on clinicians.
We are concerned.
That week, the Australian Technical Advisory Group on Immunisation changed their recommendations for the age groups who ought to receive Astra based on new data.
They have recommended an increase in the age range for those who should be using AstraZeneca from 50 to 60 and above, and they have therefore recommended that Pfizer is the preferred vaccine for under 60s.
ATAGI also said that people aged under 60 could still access Astra if Pfizer wasn't available, as long as the benefits outweighed the risks and they were making an informed decision. Now we have the Delta variant shutting down the lives of 12 million Australians, and we desperately need the community protection that vaccines can provide. The trouble is that we don't have enough Pfizer to meet the demand.
Queensland Health is just days away from running out of Pfizer vaccine supply. We requested more Pfizer vaccines from the Commonwealth as they provided to Victoria, but that request has been declined.
It's not that there are no Pfizer doses coming in, it's just that there are too few of them. Dr. Nick Coatsworth was one of the Commonwealth's Deputy Chief Medical Officers last year.
We're hitting a sort of glass ceiling almost of 150,000 vaccines a day. So as mRNA vaccine supply increases, that glass ceiling will hopefully be broken in the coming weeks and months.
Associate Professor Margie Danchin studies the shifting sands in our views on the Astra vaccine.
That risk-benefit assessment to date has really been very much based around the benefit of the vaccine preventing people from getting severe disease or going to hospital against the risk of the clotting syndrome. But what we're really hearing now and understanding 18 months into the pandemic is that people are really considering the broader benefits of vaccination. They don't want to keep going into lockdown. They want their kids back at school, and they want some more financial security and a way out, a way to be able to travel again and to see family overseas. So I think this decision-making has changed.
The Delta strain has really taken off in the UK, but the British vaccination programme, largely with Astra, appears to be keeping hospitalisations and deaths lower than last year. Public Health England claims this has prevented more than 7 million COVID infections and 27,000 deaths. So if you're weighing up the risks versus benefits of having the Astra vaccine, Here's a summary based on Australian data. If you're under 50, it's hard to estimate the risk of the clotting syndrome accurately because the numbers are so low, but it's around 3 per 100,000 first doses. If you're over 60, the risk is lower, from 1.4 to 1.9 cases of clotting per 100,000 first doses of Astra. On the other side of the ledger, here are the estimated benefits of vaccination if we were in an environment like Victoria's second wave of last year with last year's variant. In 18 to 29-year-olds, vaccination would prevent around 10 hospital admissions per 100,000 doses, and that rises to 260 hospitalisations prevented in the over 80-year-olds. But while I can quote statistics to you till the cows come home, our emotional responses can overwhelm the maths and how we balance the risk-benefit equation.
We've had very few deaths due to COVID-19 in Australia in people under the age of 50. And wouldn't it be terrible that our first 18-year-old in Queensland who dies related to this pandemic died because of the vaccine?
An 18-year-old could die, and no one wants their advice to be responsible for that. But if we look at the death statistics every year for the 5-year age group from 20 to 24, we're tragically losing young Australians to a whole variety of causes of death, and most often suicide or accidental injury. And so I think the reality of this is that whilst emotion plays into it, we need to perhaps return to the raw facts, which are even if you vaccinated every 18-year-old in Queensland with the AstraZeneca vaccine, the chances of any of them dying from the cerebral sinus thrombosis is vanishingly low.
The equation we make in our minds depends on what's happening with the pandemic around us.
My reaction is just to bring the Australian community back to the original Therapeutic Goods Administration's recommendation for the AstraZeneca vaccine, which is that it is licensed for use in individuals 18 years or over.
The situation in Australia is changing. It is more precarious. We can see that there may be an increase in COVID cases and severity, people needing to go to hospital. So I think people need to carefully make the decision rather than stepping back and doing nothing out of fear.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.